Hello and welcome to Talking Pharmaceuticals, an interview series brought to you by Making Pharmaceuticals and Distributing Pharmaceuticals. I'm Victoria Emerton, Conference Director for the events which next take place in April 2025. And in the lead up, I'll be joined by experts from UK Pharma to share insights, opinions and practical advice, providing a fresh perspective on key challenges and opportunities in the industry and to look ahead to their involvement in the events. So today I'm delighted to be joined by Peter Smith, Managing Director of Life Couriers UK. Thank you for your time today, Peter, and welcome to Talking Pharmaceuticals.
Thank you for having me, Victoria. It's a pleasure to be here.
So you're going to be giving a presentation at Distributing Pharmaceuticals in April, and the title of that is When Minutes Matter, Navigating the Complexities of Radiopharmaceutical Logistics with Expert Precision. So we're going to be talking a little bit about that today. So what is the role of radiopharmaceuticals in healthcare treatment?
Yeah, I think from that perspective, it's a really kind of evolutionary impact to cancer treatment, really. So with radiopharmaceuticals, it kind of takes away from the historical sledgehammer approach, if you like, to cancer treatment. So things like chemotherapy kind of wash away the whole immune system and really affect the patient, whereas radiopharmaceuticals is a lot more of a targeted approach. I guess similar to, in layman's terms, a bit of an Uber approach. So you kind of type into the system where you want the diagnostic to be targeting, and then the isotope therapy or diagnostic will target that specific area rather than flush out the whole body. And it's almost kind of a GPS approach to cancer treatment.
It certainly sounds a lot kinder, and a development that I'm sure has been hugely welcomed by those that suffer and those that treat people with cancer. But getting those radiopharmaceuticals to people is the important thing, isn't it? In a format that they're still efficacious. So how do the logistics fit into the radiopharmaceutical cycle?
Yeah, and that's obviously the area that we focus on, which is the logistics side of things. And sometimes it's, I guess, the hidden element of that treatment going from manufacturing through to the treatment. But it's definitely not an Amazon style of delivery where you kind of throw a vial into the post and deliver it, because I guess Amazon do a fantastic job and their network is extensive. But with this style of delivery, it's a lot more of a targeted approach from a logistics perspective. The main reason being that is that as soon as the items are manufactured, the isotopes are manufactured, they start to decay. So that's called the half-life. So it's got an extremely short shelf life. So from point of manufacture, I guess 48 hours is the longest, but from point of manufacture, some of the therapies or diagnostic could be 2 hour window from manufacture to treatment. So things like delays or any traffic delays or flight delays really have a massive impact on the treatment and can make it redundant. And as we know, at the end of it is a patient, which is a critical element. And from a logistics perspective, we have a zero failure mentality. Our SLA is kind of 99.9%, but because it's a patient first approach, we know at the end of it it's a patient and their family are associated with how that. So we don't want to disappoint. Some people call it kind of like delivering a melting ice sculpture in the middle of the summer. As soon as it's been manufactured, the product's decaying, and we have to get it delivered there before the half-life expires.
That sounds very stressful, almost up there with kind of organ transport in terms of time criticality. So how does transporting radiopharmaceuticals differ, and what are the critical factors? Anything else to add to that?
Yeah, and I think, like I say, the degrading side of things, so the half-life is the critical element. So as soon as it is manufactured, it starts to deteriorate. So that's something I touched on in the previous response. But there's a lot of other elements there because it's a nuclear therapy. So the compliance and the regulation are very tight. There's a large barrier to entry. It's not quite dressing up in bio suits and everything else, but it's not far off. if we are getting delayed from transportation, if there's an accident, then there has to be extreme measures because of the kind of product that we're transporting. So it's full compliance from driving, training. They have to go into ADR, which is like a dangerous goods by road training training session. So all the drivers have to be fully compliant on that side of things. We also have to make sure we've got critical response in place. So if there are any delays, we've got additional vehicles that can come in and help. So the contingency planning is really important on that side of things as well.
So it's incredibly specialist. So how do Life Couriers differentiate themselves to support the radiopharmaceutical sector?
Yeah, so historically, I've been with Life Couriers for the last 3 years. I come from an industry where it's kind of express parcels, and the service level is kind of 98.5, and that's a really acceptable and people are comfortable with that level. We offer a 99.9% service level, and I always said when I came in that was nonsense. There's no way somebody can achieve that on a regular basis. But it's true, and I think from our perspective, it's because it's that patient first mentality. So across our business, we have a mantra or a mission statement, which is delivered with care. So the care model is our kind of what we hold ourselves to as a standard within the business. And the care stands for customer excellence, accountability, respect, and enthusiasm. And that's something that's really ingrained across all of our team. Any new members of the team are also onboarded, and we specifically will do a welcome on board kind of a Zoom call or a Teams call, just so they fully understand what the culture of the business is. And that's about, it has to be a patient first mentality. We're not just delivering a pair of trainers or somebody's Xbox, which obviously are not equally important, but are also important. But this is life enhancing, or at times life-saving deliveries. So the kind of element of we have to focus on patient first, zero failure, really comes to the fore on that. And it's kind of then ingrained across the whole of the team in the business, and something that we're very proud of.
Yes, as you say, life-changing and as you say, potentially life-saving delivery. It really focuses the mind, I imagine. So what are the potential complications of radiopharmaceutical deliveries, and how do you negate these?
Yeah, so on that side, there are a lot of potential implications. So delays in transit are ones that I've spoke about. So it could be a flight that's been cancelled or held. It could be a traffic delay. It could be a vehicle breakdown. So all about that side of things is contingency planning, making sure that we've got a plan in place. So if the vehicle breaks down, we have a vehicle on hand that can go in straight away as a backup and make sure that we're not having an unsuccessful delivery. There's a lot of compliance and regulation that we have to overcome. So being part of the overall Life Couriers Global, we have a global compliance team, a global regulation team. So they deal with continuity across the globe, if you like, to make sure that we're having the same practices across all of our deliveries, across all of our team. So from a compliance and regulation, that's really important, an area that we focus on as well because of what we're dealing with. As soon as you start talking about nuclear or uranium, then I think that kind of springs to mind panic across people about how this is going to be safely transported. So from our side of things, everything has to be adhered to from a compliance and regulation to make sure not only that we're preventing the safety for our team, but also we give peace of mind to the patients that we're delivering to and to our customers as well. We do full GPS tracking for all of our vehicles. So from a route planning perspective, we know where our vehicles are. We know where the traffic issues are. So if there are any delays, then we're able to get to that team as quickly as possible, or hopefully kind of proactively avoid any traffic issues to make sure that we're delivering on time to the patient. So yeah, there are a lot of regulations and a lot of potential pitfalls, and that's the same across all of the logistics side of things. We know that there's a lot of factors that are out of control, I guess, from our perspective, because it's such a tight delivery window, in some instances 2 hours. it just makes the like you say earlier, the stress a bit higher sometimes on that side of things.
And you'll have weather to contend with as well, haven't you? I don't know if you
Exactly,
keep an eye on the weather.
yeah,
So
exactly.
that sounds, your approach sounds incredibly reassuring. You've got to be on point, and if your record is 99.9%, that's amazing. So people can find out more from you in your presentation at Distributing Pharmaceuticals, and the title of that again is When Minutes Matter: Navigating the Complexities of Radiopharmaceutical Logistics with Expert Precision. So to pick Peter's brains, do come along to Making Pharmaceuticals. Attending the exhibition and conference is free, and registration is currently open at www.makingpharma.com. The conference programme is also live on the website, so people can look at that, plan ahead, and work out how best to use their time when they're at the event with us. So thank you very much for your time today, Peter. We look forward to seeing you at the Coventry Building Society Arena and everybody else watching this on the 29th and 30th of April. Thank you very much.
Thank you for having me, and this will be my first event, so I'm thoroughly looking forward to it and anticipating hopefully a fantastic event. Thank you, Victoria.
I look forward to meeting you very soon. Thank you.